Good morning. We have Dr. Sam Atallah joining us from Piedmont today. Thank you for being here.
Thank you for having me.
I am so excited to have you here. We have a few questions to talk about, talking about colorectal cancer. What do people need to know about colon cancer in general?
So the most important thing to know about it is that it is actually preventable if you get appropriate screening. And it's a very common cancer. We definitely need to know. We hear a lot about breast cancer, don't we? And it is a very common cancer. It is actually twice as common as colon cancer. However, more people are going to die this year from colon cancer than they are from breast cancer. In fact, it's the #2 cancer killer right behind lung. So it's an important common cancer. It is preventable if you get appropriate screening. So that's important to know.
Wow, so we do need that screening. And so you talked about it being preventable. What are some signs and some symptoms we need to be looking out for? Maybe we don't feel right. How do we know we need to go get checked?
For sure. So there are definite signs and symptoms of colon cancer. You can have changes in your bowel habits. So for example, if you're going to the bathroom regularly and then all of a sudden there's a change in how you're going to the bathroom, that's a sign you need to go see your doctor. It doesn't mean you have colon cancer, but it means you need to be checked, all right? So that's one thing. Another thing is if you have blood mixed with your stool, cramping pain, nausea, other signs like this, or if your stomach area is getting pretty distended, that could be a sign of a blockage, which is a serious kind of complication that results from colon cancer. So those are all signs to get checked out. But even if you don't have any of those signs or symptoms, you should definitely get screened. And the recommended screening age for everybody, men and women alike, is age 45, which has recently been lowered from 50 because we're seeing more and more folks who are younger develop colon cancer. We've seen a 53% increase since 1994 in younger patients having colon cancer. And by younger, I'm defining that as under the age of 50.
Wow.
And so, whereas when I started practice in 2007, we were seeing very few people in their 40s with colon cancer. It would be unique. Now it's almost all the time.
Now this is more normal.
It's more than normal.
Wow.
So we got to get folks screened and checked with colonoscopy, which is the gold standard and best way to diagnose colon cancer. But even better than that is colonoscopy goes in, looks and examines the entire colon and is able to identify small growths called polyps. Polyps grow and grow and grow and over time transform into cancers. Well, guess what? We can go in there and remove those before they ever have the chance to develop into cancer. So fortunately, this is a type of cancer that if caught early, for example, stage 1 cancers of the colon or rectum, can be cured 95% of the time. So it's a very curable type of tumor.
I think the big thing that he mentioned is really that early detection. It is curable. Now, I understand you co-developed a special technique to treat rectal cancer. Can you talk about that?
Yeah, I want to talk about some of the techniques in general. So we've come a long way in the past 10 or 15 years. Nowadays, we can do things minimally invasive, laparoscopically. We can remove an entire organ, such as the colon, without even touching it, without even using a single clip. Using advanced laparoscopic techniques. So laparoscopy itself has evolved. And on top of that, now we have robotic platforms that allow us great precision. We're able to see things very, very well in a steady, secure operative field where we really can concentrate on something and see it in a magnified way and use very precise instruments to remove and dissect tumors of the colon and rectum. And yeah, about 10 or 15 years ago, I developed a technique with 2 of my partners where we're able to go in and remove tumors of the rectum specifically that are early stage. So rather than having to be cut open from your abdomen, we just go in through the rectal area, the rectal cavity, and remove it that way. And that really has transformed the recovery process and lowered significantly the risk of specific kinds of problems that result from pelvic surgery, especially, which is where the rectum is located. One of the hardest areas to operate on from the abdominal cavity, now we're able to, with this technique called TAMIS that I co-developed, able to remove such polyps and growths and early cancers
Wow.
through the rectum.
That is incredible. If you'd like to find out more information about this, head on over to our website, 41nbc.com. Thank you so much for joining us.